at the Chart Statewide Operations Center. Over the past several weeks, we have been saying that while we're hoping for the best, we are also actively preparing for the worst. A few hours ago, the World Health Organization declared the coronavirus outbreak to be a global pandemic, saying we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction, and citing that the number of cases outside of China has increased 13-fold, and the number of affected countries has tripled in just the past 2 weeks. Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, told leaders on Capitol Hill today that the coronavirus is roughly 10 times more lethal than the seasonal flu. Tomorrow, I will be addressing the nation as I give the State of the States address on behalf of America's governors as chairman of the National Governors Association at the National Press Club in Washington. But today I'm here to update you on the latest in Maryland. But first, let me just give you some of the most up-to-date big picture facts as we know them. As of this hour, and the numbers may even be changing behind me, but more than 121,000 people in over 100 countries have been infected by COVID-19. Over 4,300 people have died. Here in America, there are over 1,000 cases and 31 deaths across 42 states and Washington, D.C. 24 governors have declared a state of emergency. This situation is escalating rapidly. Information is changing not only on a daily basis, but on an hourly, almost minute-by-minute basis. Here in Maryland, the state currently has 9 confirmed cases of COVID-19. Earlier this afternoon, I announced that a Montana resident who was visiting Anne Arundel County tested positive after being alerted that she had been in close contact with a confirmed case. The patient, a woman in her 70s, presented for testing at a hospital here in Anne Arundel County, which did take all of the necessary precautions to protect patients and staff. While this will be classified as a Montana case, the Maryland state and local health officials are taking the lead in the investigation and tracing the patient's interactions with the public. We are working in close coordination with Montana officials, and I have been in touch with Governor Steve Bullock. As I announced earlier this week, the U.S. Department of Health and Human Services has notified us that 12 Marylanders are aboard the Grand Princess, which is docked on the coast of California. All 12 Marylanders and the other U.S. citizens on that ship are in the process of being transported to military bases in Texas and Georgia for examination and to be quarantined. Last night, the Department of Health and Human Services submitted a request to us to send those passengers who are not showing any symptoms back to their home states. We want these Marylanders to be able to come home. However, we also want to take every precaution to limit the spread of COVID-19 in our state. So we have informed the Department of Health and Human Services that they must test all 12 of these passengers for COVID-19 on the military bases before we take any steps to return them here to Maryland. All those who are cleared and test negative will be safely transported back here to Maryland. Anyone who tests positive will remain in quarantine on the respective military base. We will continue to provide updates as that situation develops. Also last night, we learned that a volunteer first responder in Montgomery County, who is a resident of Prince William County, Virginia, has also tested positive for COVID-19. This case is tied to the rector of Christ Church in Washington, D.C. So the state of Maryland is coordinating on this investigation with the Virginia and D.C. health departments. And I can report to you that our state's chief epidemiologist has cleared both the fire station and the fire crew where the patient volunteers and has no major concerns regarding potential risk to the community. I also want to provide an update today regarding the village at Rockville, the retirement community where one of our first positive cases attended a gathering in late February. We are deploying a team of health department officials to test those residents, staff, and family members who attended the event and who want to be tested. We are fully committed to being transparent, providing all the facts, and continuing to keep Marylanders informed. Yesterday, I convened a nearly 2-hour emergency meeting of our entire cabinet and senior staff, where we discussed additional measures in our all-hands-on-deck operation to combat this evolving threat. Today, I am announcing that the state's Motor Vehicle Administration will immediately begin moving toward an all-appointments system for all transactions in order to eliminate walk-ins, reduce foot traffic, and keep crowds to a minimum. The Maryland Health Benefits Exchange is establishing a special enrollment period through Maryland Health Connection specifically for the coronavirus. Through the federal market, though the federal marketplace is not offering this kind of enrollment, we wanted to do so in order to provide peace of mind to Maryland residents. The Department of Public Safety and Correctional Services is discontinuing visits for individuals currently in infirmaries, reducing programs and movement within facilities, providing more video visitation opportunities, and requiring staff who exhibit any flu-like symptoms to remain home. Yesterday, I convened the leaders of the state's long-term care community, which includes nursing homes, assisted living facilities, and retirement communities. Today, we issued the following directives effective immediately. Nursing homes will have restricted access to essential visits only. We will be prohibiting other non-essential visits, prohibiting all staff from any international travel, and we are recommending that these facilities actively screen all individuals entering all of these facilities and restrict entry to anyone showing any respiratory symptoms or anyone with any possible exposure to COVID-19. I am also announcing today that all state veterans facilities will be required to follow these same guidelines. The National VA has also done this nationwide. Our Charlotte Hall Veterans Home will also be instituting these guidelines. Once again, I want to remind everyone that the state of Maryland is operating under a state of emergency. Marylanders should be taking this pandemic very seriously. All Marylanders need to understand and prepare that there may be significant disruption to your everyday lives for a period of time. Local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should actively consider modifying, postponing, or canceling mass gatherings. Local businesses should prepare plans for office closures that require their employees to work from home for extended periods of time. These are the kinds of things that people need to start planning for immediately. I urge Marylanders to remain calm, but to stay informed on a continuing basis by paying attention to the media. And all of you, thank you for helping us get this message out. Also by visiting the federal website, coronavirus.gov, And Maryland residents can also get the latest updates at health.maryland.gov/coronavirus. And if you have any questions or concerns, you can call our hotline at 211 to connect with a helpline representative to get information or community resources on the coronavirus. We will continue tracking this. We will be receiving and providing Marylanders with almost constant up-to-the-minute information. And I want to continue to assure all the people of our state that Maryland is taking every potential precaution when it comes to this coronavirus, because our highest priority is keeping our residents safe. With that, I'd be happy to take some questions.
Governor, any discussions regarding pushing back or adjusting the state elections, the primary elections next month, and extending the IRS or the local deadline for time?
I know that the State Board of Elections, which is an independent body, did notify one of my staff members today that they were considering making some adjustments on the election on April 4th, but quite frankly, I'm not up to speed on that. It wasn't at the top of my priority list.
Governor, I know for now, at this hour, no new confirmed cases. Is that encouraging news, or how would you characterize our current situation with the state?
Well, look, I think we acted earlier than most states in the country to declare a state of emergency and to take many of the actions that today other states are starting to take. It's encouraging that our numbers are not as high as other states, but I don't want people to be too encouraged, because as I said yesterday and the day before, with the expansion of the testing, we should be prepared for dramatically increasing numbers, exponentially growing in the days to come. So yes, we're pleased that our numbers are relatively low in comparison to some of our other states, and we're hopeful and we're hoping for the best. We are preparing for the worst. I'll give you a couple of examples. Last Sunday, I was on the phone with my vice chairman of the NGA, Governor Cuomo, and he didn't have a single case at 2:30 in the afternoon. At 9 o'clock that night, declared their first case. They're up to, I think, 190-some cases now. I was on the phone last night with 25 other governors. Governor Baker in Massachusetts, who I think just a week ago had their first case. As of last night, he was up to 94 cases. So, knock on wood, we're doing pretty good. I don't want anybody to be lulled into a false sense of security that we're going to stay there.
Governor, the Montana visitor, were they in contact with someone in Maryland who tested positive, or Montana and they visited them?
Neither one. And I don't want to get into too much specifics, but they were in contact with someone in a different state and then traveled to Maryland, bringing it with them. They came to visit a family member in Maryland and didn't feel well, and luckily we handled the situation, I think, the way it was supposed to be handled, and then our health department reported it out to their home state, which is the way the guidelines follow, and then I personally reached out to the Montana governor to let him know. He actually heard it from me first before he heard it from his health department. Yeah.
At what point will the state lab expand the criteria for testing so that testing is given to locations other than
Yeah, it's really more of a federal issue and how fast they can get these things up to speed. It has nothing to do with the state lab, and the state lab probably won't change their criteria. Most of these tests are going to be done by the private labs. The state has to preserve its lab capabilities for the investigations we're doing that are trying to track the cases that we're trying to interrupt and stop the flow of transmission. Other people who want to be tested or their doctors want them to be tested for whatever reason are going to go through Quest and LabCorp and other places through the hospitals, but the state lab probably will not have the capacity to handle those. And there's currently, they're ramping up that as quickly as possible at the federal level. I think they went from 1 million to 4 million. It's going to have to go tenfold higher than that. And it's an issue in every single state. And frankly, I believe that we are going to have problems with availability. I think it's going to continue to be a problem across the nation and across the world.
You've listed all the different places that are shutting down visitors to necessary only, but what should the people at home watching this, the mom with kids, what should they be doing to prevent the spread?
Well, so we're going to continue to issue guidelines, go onto the website and there's some very practical advice about some things you can do to remain safe. Again, the people that are most impacted and most vulnerable are older adults. And so we gave out advice yesterday. The reason why we're so focused on the nursing homes and the assisted living facilities, the average person at this point that gets the disease is 60. The average person that dies from the disease is 80. And so nursing homes and assisted living facilities, people with underlying medical conditions who are older are really the most vulnerable, where the mortality rates are highest. But kids and younger adults who may not be as susceptible to really serious illness can transmit those diseases and make it spread in the community, where we then have problems with those vulnerable populations. So the social distancing is something that we're looking at and talking about, keeping away, and watching symptoms. And we're going to continue to look at what the recommendations are coming out of the federal government, what other states are doing. We have the best, smartest people in the state trying to give us additional guidance on steps that can be taken.
Next question, please.
Go ahead.
Regarding the 12 Marylanders that are aboard the Grand Princess, can you revisit that point really quickly? Have their family members or anybody, have the family members reached out to your office, waiting on family home, or what's revisit that point?
That's a great question, and unfortunately, the information from the federal government has not been that forthcoming. We've been somewhat frustrated by that. There are, I think, 3,000 passengers on that ship. It's been docked. It's taking days and days to get all of them off in a safe way. We don't have all the information about each of these folks, so how much contact that the federal government and the military has had with the family members is something I'm not sure of. We don't even have all the information about the identities of the people or which military bases are going to yet, which is of great frustration to me personally. But we're trying to get that information, and as information becomes available, we're going to share that with you. But it's not just our 12 folks. I mean, I believe there's 3,000 some people on that ship, and they're trying to get them all off, at least all the Americans. And I believe, others that are from other countries are even a bigger issue, and the crew members that I'm not sure some countries aren't taking them back.
You mentioned recommending consider canceling mass gatherings. What criteria should they use, and when would you make that recommendation statewide, the way we see the one from D.C. just today?
Well, we're going to make those decisions based on the criteria on the ground, but we've passed that decision making down to further down the chain. For the city of D.C. can make decisions about the city of D.C. City of Baltimore can make decisions about what they want to do in the city of Baltimore. Our counties can make decisions about that. A city of less than 1 million people is different than the size of a state. The federal government's not dictating to us what to do. They're giving us guidelines. We've passed down from our state to the local school systems to be able to make their own decisions about school systems closings, individual schools closings. I, as the governor of Maryland, am not going to make decisions about which event to close, which school to close, what individual jurisdictions should do. We're going to give them the best advice and guidelines we can, whatever the federal government is passing on, whatever our experts think, and then other individuals we're going to empower them to make their own decisions.
Thank you.
Yeah, thank you.